Patients who are confronted with a diagnosis of having to undergo surgery have many concerns, including finding the right expert, the risks and safety of the surgery. I spoke to Dr. Kofi Derek Bohene, Associate Professor at Johns Hopkins Medical Institute and one of its lead surgeons. In part one of our interview, we discussed the work of a surgeon and the challenges of addressing surgeries and healthcare in some African countries.
I'm a teacher, so when I go, I'm going to be training medical students and people who are training to be surgeons. And I'm a healer, so I'm taking care of people who come to me daily. But when we pin it down to what my specialty is, I do facial, plastics, and reconstructive surgery. So surgery limited to the face only. And it can be children born with congenital problems that you have to fix, or people who are deformed from car accidents, or people who, for the unfortunate circumstance of having had cancer removed, have to have a reconstructive surgery done. So that's probably about 50% of what I do. And then the rest will be finding ways to take brain tumors out or tumors that are hidden under the skull of the brain. So I combine sort of two expertise.
So what would you say is one of the most challenging surgeries that you have to do?
Challenging sometimes in terms of the length of surgery. Some surgeries can go up to 12 hours and you don't move. Most of them has to do with taking tumors out under the brain because there are so many important structures in a very small area, and if you move half a centimeter in the wrong way, you can kill someone. And usually you are on the edge throughout those testing moments. But the reward at the end is quite huge when you can walk to someone's family and tell them everything went well.
What does it take to be a good surgeon? Of course, you have to go to school, to training and everything, but what other qualities do you think?
But you have to look good doing it, meaning you do it without leaving telltale signs that you were ever there. So that when you're done, you are restoring function to the person, but not disrupting too much stuff. So patience is a big one. And I think practice and practice and practice is the other one. And more importantly, you shouldn't be very scared of looking at blood, which to me was the opposite because I started off in life, could not stand the sight of blood.
Tell us what was one of the key moments that determined your career today?
There was a telling experience that I had when I was in high school, boarding school, where one of our schoolmates got injured in a car accident and we had to carry him as 16-year-olds to a hospital. And that was where a turning point really happened, that you find yourself with a schoolmate, helpless, you think he's going to die, and there's no help for that person. And all around you, there's pain and groaning and moaning, and not enough doctors to take care of. And that was an experience that I didn't like. And I said, you know, I'm going to come back and change this. And along the line in the story, it really did happen that I was able to contribute to change things in that hospital.
When you look at the health system in some of the countries, what do you think is most pressing today?
My observation is that the countries that I have visited, maybe with the exception of a few and recently, have not put a lot of resources into healthcare. I would take an example as Ghana. That's where I'm from. My aunt died of something simple called DVT, which is a blood clot in the leg that traveled to her lung, and she died. When she went to the hospital, the doctors are overwhelmed with seeing children with malaria, that everything that comes through is malaria till or proven otherwise. So nobody has the attention to go further because they are overwhelmed. One, because the resources are not there, and two, it's not because of lack of expertise, they're just overwhelmed. And sometimes we ask the government maybe to try to do too much, and I think whether the government works to help or not, the private sector should just help and then just shine the light wherever they are. So my foundation is teaming up with another foundation that we are going to just focus on this small area and just make a difference, and hopefully it spreads.
And next time, in part two of my interview with Dr. Kofi Derek Bohene, we will discuss his medical missions to Africa and some life experiences on his journey to becoming a doctor.